Hello all, this is Dr. Alsup, and in this video we will be discussing the anterior compartment of the arm. And specifically, we're going to identify the three main muscles and discuss innervation, actions, and any important anatomical or clinical relationships we need to focus on. So as noted in previous learning objectives, there is an anterior and a posterior compartment of the arm. And when I say arm, I don't mean the entire upper limb. I'm speaking specifically of the region between the shoulder and the elbow. The anterior compartment of the arm is located, as you might imagine, anterior to the humerus and separated from the posterior compartment of the arm by thick areas of deep fascia called intermuscular septa. So it's really what's helping to form those muscle compartments. There are three muscles of this compartment: biceps brachii, brachialis, and coracobrachialis or coracobrachialis. You'll hear it either way. Biceps brachii often gets the most playtime in discussion, perhaps due to the fact that it is more superficial. But there are also some notable complexities with this muscle. So we'll talk about this one in a little bit more depth. All of these muscles are primarily innervated by the musculocutaneous nerve. So instead of memorizing biceps brachii is innervated by musculocutaneous, brachialis is innervated by musculocutaneous, etc., just note that the muscles of the anterior compartment are innervated by musculocutaneous, and hopefully that helps a bit with cognitive load. So let's discuss some of the major details of each muscle, and we will spend the most time with the most superficial of the bunch, which is the biceps brachii muscle. This muscle is referred to as a three-joint muscle, which means that it crosses and is capable of affecting movement at three joints. So this would include the shoulder joint, it would include the elbow joint, as well as the proximal radio-ulnar joint. As the biceps portion of its name might suggest, there are going to be two proximal tendons, most typically referred to as heads. So two heads called the short and the long heads. And both attached to the scapula, just one is a little bit more superior and a little longer, so it gets the name long head. As mentioned, both are attaching to the scapula. These proximal tendons will lead to muscle bellies. So you'll have these two separate muscle bellies that will coalesce into one distal tendon that attaches to the radial tuberosity of the radius. This attachment on the radius allows it to play a role in terms of supination of the radio-ulnar joints. I do want to kind of move in on the long head or tendon of the biceps brachii because this area has some increased clinical relevance. The long head arises right at the top portion of the glenoid fossa, and it actually is going to cross the head of the humerus within, so this is key, within the joint cavity. So it's traveling through the joint of the shoulder joint or the glenohumeral joint. So just the fact that it is in the joint cavity of the shoulder joint has implications, particularly if there's issues within the joint. So this could affect this tendon. It could cause mobility issues in regard to biceps brachii. Additionally, this tendon will descend and travel through an area called the intertubercular sulcus. Sometimes you hear it referred to as the bicipital groove. And this is going to be located between the greater and the lesser tubercles. So it's this region kind of right here. And there's actually a ligament that connects the tubercles, making essentially a canal for this tendon to travel. This ligament serves to keep the tendon in place or prevent what is called bowstringing of that tendon with particular movements. But with repetitive movements and wear and tear, this can cause inflammation of the tendon, or biceps tendinitis, usually the result of repetitive microtrauma. In more severe cases, the tendon can actually dislocate or kind of be moved out of place, or it can even rupture, and that has implications in terms of what the muscle will present as. And you'll actually have more on this in an upcoming lecture. Deep to the biceps brachii, there are two other muscles. The brachialis is one, and it's the more distally placed of the two. Its proximal attachment is on the mid-humerus, and distal attachment is on the ulna, so it will only affect the elbow joint, as it does not extend all the way up here on the scapula. This is a sneaky little muscle. It's much more powerful than it appears, typically because it's blocked from view or easy palpation by the biceps brachii. Also deep to biceps brachii, but more superior medially placed, is the coracobrachialis muscle. This extends from the scapula. In fact, it extends from the coracoid process. That's where it gets its name. So it extends from the scapula to the mid-humerus, so does not reach the elbow joint and thus can only directly affect the shoulder joint. An important anatomical relationship here is that the musculocutaneous nerve actually pierces the muscle belly of coracobrachialis, so an easier means of identifying this nerve. The chief action of this compartment, the chief action of this compartment really occurs at the elbow joint with flexion of the elbow joint, so reducing the angle at this anterior portion of the elbow joint. It's actually the brachialis muscle that is the prime mover or workhorse of this action and flex the elbow no matter what is going on. So resistance, no resistance, pronation, supination, it doesn't matter. The brachialis will play a role. Biceps brachialis muscle's effectiveness in this movement is a bit more contingent and affected by the position of the elbow and the forearm, but it certainly plays a role in flexion as well. Biceps brachii can be a very forceful supinator of the radio-ulnar joints. So supination is the rotation movement that aligns the radius and the ulna, so they'll be parallel to one another, as opposed to kind of crossing over. The radius will cross over the ulna as what occurs in pronation. We will talk a bit more about the specifics of these two actions in an upcoming learning objective on the elbow joint region. Lastly, those muscles that cross the shoulder joint, such as coracobrachialis and the long head of the biceps brachii, can and will certainly play synergistic roles in some actions of the shoulder joint, such as flexion or adduction. But again, these are more synergistic, and it's really these more distal joints that this compartment plays its biggest role. Excellent. We have reached the summary slide. Here you see generalizations of the entire compartment over here, with a few high-yield areas to focus on for those specific muscles. Thank you for your time and attention, and I hope you have an excellent rest of your day.